All right. Hi, everybody. We're so glad that you're joining us today. My name is Shireen Heidari. I'm a palliative care physician at Stanford. I'm going to spend a few minutes doing some brief introductions, and otherwise we're going to spend most of our time today in a more interactive format with our panelists. Our goal today is to provide a glimpse into palliative care, what it is, who can benefit, how palliative care teams can support people diagnosed with a serious illness. My hope is that we show that palliative care is about much more than talking about the end of life. It's about focusing on the things that bring you meaning and joy, living well at any stage of a serious illness, managing any symptoms that may come up while you're receiving your treatments, and maximizing quality of life. Palliative care is provided by a team of nurses, doctors, social workers, chaplains, working alongside your primary teams, and can be provided in multiple locations, in the clinic, in the hospital, from home with telehealth. Being diagnosed with a serious illness like cancer, heart failure, lung disease, or dementia can affect many dimensions of your well-being. A palliative care team can be an extra layer of support for patients and families as they face a serious illness. We'll talk more about that in the next 50 minutes. Here with me today is a team of palliative care experts. We have Gary Bertuccelli, a social worker in our outpatient palliative care clinic. Tim Handley, a palliative care advocate. Tim had the support of a palliative care team along with his cancer treatments and has offered to share some of his story and insights with us. Kafunyi Mwamba, a spiritual care provider in our outpatient palliative clinic, and Natalie Normandin, a clinical nurse specialist on our hospital palliative care team. We're also joined by members of our palliative care health education team who may help moderate some of the questions. We'll spend a little time today telling you about ourselves, talk through some of the frequently asked questions we get about palliative care from our friends, families, coworkers, and try to leave time for questions from the audience as well. We'll do our best to answer as much as we can, knowing that 50 minutes is not a long time. But we hope that this can serve as a starting conversation about whether or not palliative care might help you or help someone you know. With that, I'd like to get us started. Tim, thanks so much for being here.
It's a pleasure.
Oh, thanks. Could you share a little bit about your cancer diagnosis, your experience with palliative care, maybe some of your initial thoughts when you got referred, and maybe how your experience with palliative was different than what you might have imagined?
Well, sure. I mean, we rehearsed it after all. So I am the poster child for a successful palliative care candidate, and that's why I'm here to advocate. And I wanted to just give a little context about my history because I think it'll inform why palliative care was so transformational for me. So I'm a tennis player. That's really how I identify rather than through a career. It paid for my college. Secondarily, I was an entrepreneur, still am, I guess. And I founded a company that sold about 100 million credit reports, and we had a workforce of 125. And it was a 20-year run that, you know, died when the mortgage crisis hit in 2008. So I quickly went into this depression starting in maybe about 2009, and it was extremely persistent and treatment resistant as well. And anybody that surfs can relate to the fact that, you know, sometimes you feel like you've gotten your head above water only to have another wave come crashing down. And throughout that time from 2008 until I got into palliative care, you know, my youngest had scoliosis. I had a tennis protege that right out of medical school killed himself. And my dad killed himself too, not during that time, but when he had an economic collapse, as did the people in 1929 jumping out of the building. So it's not inconsistent with, you know, there being kind of a underlying condition when you lose everything, which I did. And then I got divorced, and worst of all, moved to Louisiana in 2015. So it was a really trying time. Every time I thought I got above it, wave would come crashing down. Yeah. And I was depressed. And I remember feeling a little lesion here when I first got to Louisiana. And I remember looking in the mirror and egging it on, even shaming it, going, I hope you're not like a little, you know, wussy little tumor. I want you to be something significant, because I couldn't kill myself since my dad already did. That would be bad for my daughters. They'd have a tenfold increase in their own risk of suicide. So that option was off the table, but I was left with hoping for something to take me out. And cancer would be the best, because then no one could say it was suicide or an intentional thing, just powerful manifesting on my part. So that's the setup, and got the cancer. It followed my commands. About 2008, I started getting this facial paralysis, and diagnoses led to cancer of the nerve and the parotid. And so in November, I had the surgery to get it out. It was like a 12 to 14 hour surgery. And I was thinking I was recovering okay. And then a couple of weeks later, I was informed that I had MRSA, and I had to be rehospitalized. And when they told me that I had MRSA, my oncologist immediately said, get him to palliative care. And when he said that, I almost wanted to hang out one of those George Bush mission accomplished things, because, you know, at best, I was indifferent to the fact that it appeared that I was going to die, because I didn't really know what palliative care was. But I knew that Paul, not being a Latin expert, but Paul seemed to go with pallbearer, and someone casts a pall upon the room, it's not a good thing. So yeah. I just assumed that, okay, I'm going to die. And then I met Dr. Grant, who was the primary pain medicine guy. And that's really kind of what I thought would be the thing, is just to kind of ease my suffering as I descended into death. And quickly learned that, no, it doesn't mean I'm going to die. And the hallmark of his, of the process that was so healing was they took a really holistic approach to making my journey through all this, you know, comfortable, and, you know, with an eye towards, you know, getting me back up on my feet. And obviously one of those underlying conditions was diagnosed, the depression. And Dr. Grant, Dr. Sheila took it upon themselves to collaborate and construct a treatment plan that included the other aspects of the palliative care, you know, the social help with regard to the circumstances surrounding having no income and having an illness, and all those things. And it worked in concert to make an enormous difference in my life. And so anyway, I sit here brimming with gratitude for you guys, the team, what you do, and that was my story.
Yeah, thank you so much. I'm glad we were able to help, and I'm glad that also it wasn't as scary as maybe it could have been, right? In terms of us being all about the scary stuff. Along those lines, I think, Natalie, you know, we hear a lot that people will say, oh, it's too soon to call palliative care. It's, you know, maybe later, maybe, you know, in a few months, maybe down the line, but not right now. When you hear that, especially given what Tim just said, like, when would someone ideally want to get a palliative care team involved in their care?
I would say it is absolutely never too soon for palliative care. I think, you know, in fact, one of the most common responses that I have after meeting people and their families is, I wish I had known about your program before. I wish you had been involved in my care sooner. I think kind of we know that palliative care is appropriate at diagnosis. When someone finds out that they have a serious illness, that's when our care can begin. Kind of our focus is helping you live as well as possible while you're dealing with an illness. It might be helping with your symptoms while you're going through the different treatments or symptoms that you're having because of your illness. There's actually a lot of evidence to support early palliative care. There are studies to show that people with earlier palliative care involvement have improved quality of life, better symptom management, decreased anxiety, and some studies actually show that people live longer when palliative care is involved. Yeah, so I think we don't have an agenda when we meet people other than just helping them where they're at and making sure that they live as well as possible.
Absolutely. Thanks so much. Anyone else have thoughts about just it being too soon for, I don't know if Gary wanted to chime in or Kafunyi?
Yes, it is very, very important for people with serious illness to be referred early enough to palliative care. There is actually a research from Duke University that shows that people who receive palliative care earlier make fewer hospital visits. This is because of the interdisciplinary team approach on the palliative care with doctors, nurses, spiritual care providers, and social workers working actually together to provide the relief from the symptoms. This might be physical, spiritual, emotional, psychosocial, and also stress of a serious illness, and to improve the quality of life for both the person who is dealing with serious illness, but also the family as well. So that is why it is extremely important.
Yeah. I want to talk a little bit actually about that interdisciplinary aspect. Thanks so much, Kafunyi. Gary, you know, when we think of medical teams, often I think, or at least, you know, when my family thinks about a medical team, our minds kind of immediately go to nurses, doctors, and yet social workers play a crucial role in supporting patients as they undergo their medical treatments. Can you tell us a little bit about your work as a palliative care social worker?
Sure. You know, I think social workers, a lot of times people associate them with the people who come and take children from difficult situations. So there's negative associations with social workers. No, we don't need that. But really the social work is a profession that is all about, you know, working with individuals and families to help enhance their own social functioning, to help their overall well-being, which really are the goals of palliative care in living well with a serious illness. Social work does look at the whole person, and it's about helping individuals and families find solutions, identify and strengthen their own inner resources, assisting them in just building their own inner resilience and coping strategies, connecting with community resources. I think I can give a few specific examples that kind of flesh this out. You know, not long ago, I worked with a patient and he was having a lot of distress because one of his children had drug and alcohol issues, which made behavior erratic. The son wanted to be involved. The patient wanted that, but it was just a really stressful, unhelpful dynamic. And the patient really struggled with this. It was a source of distress. And in working with the patient, it was really helping this individual learn a little bit more about substance abuse, drug abuse, assisting them in helping to set good boundaries, which was the impetus for the son to get assistance, to get help and treatment, which resulted in the son being able to re-enter the patient's life, be of support. There was healing in their relationship and just a sense of well-being that happened for the patient because of that. Yeah. Sometimes it's practical stresses. Tim, you mentioned just the stress of not being able to work and the financial worries. And I recall a young woman who was out of work and just really wasn't aware of what's available to people in that situation. And she never thought that she would be eligible for something like Social Security disability. And we talked about that, helped her through the process, and she was approved. And it was a huge relief in her stress to have an income. And sometimes it's the more, you know, kind of personal identity issues that come up when we lose function. Think of a patient who was a creative soul and felt that she couldn't be creative anymore. And it was really helping her to take a look at that, helping her to reconnect with that creative side and giving her an outlet where she was able to make things that she provided to other cancer patients. And that was a source of meaning in her life at a time that was really difficult as she was going through her treatment.
And facing these things can really challenge your sense of self, can really challenge just your ability to participate in the things that brought you joy. It can challenge the ways you think about yourself and the ways that you make meaning. So I think that's huge. Yeah. Thank you. You know, Kafunyi, I think a lot of our patients don't necessarily identify with a particular religious group. And, you know, given that, why is spiritual care such an essential component of the team? How do you think about your role as a spiritual care provider and a member of the palliative care team?
Thank you, Shireen. That is correct. Most people, they associate spiritual care as being part of a religion, being religious. And sometimes even they associate it with, do you know something I don't know? They think maybe because of death, they associate you with like, am I dying, you know? So they get scared when they see a chaplain or spiritual care provider. But I will say that every person with serious illness tells a story of being in spiritual distress, regardless of having a religion or not. So my role on the team is to help this person to find meaning, peace, comfort, strength, or connection in life. I do this by being present with the person, and I'm there listening and assessing if there are any spiritual needs. And then I will help this person to find mechanisms of coping in things that give hope. This has not to do with religion. It might be anything that gives this person to be able to give hope or give strength. So I will quote Elizabeth Kubler-Ross that said that hope, H-O-P-E, is the belief that there will be a positive end to the change and that there is some meaning that will eventually be learned from the experience. And that is our role, is to give that hope, whatever that is.
Absolutely. I think that's really, really important. And it's not just about religion. It's really about kind of joy and meaning and sources of strength, as you brought up. And I think that's huge. Tim, I want to bring it back to you a little bit. You know, I think many patients have so many teams or medical teams already involved in their care. And sometimes people will ask us, well, okay, why would we want to see a palliative care team when I already have so many other doctors? And I feel like you touched on this a little bit. Would you mind talking about it a little here too? And then maybe we'll have others join in as well.
Yeah, and you're right about that. I was fortunate to go through Stanford, and thus I had more doctors attending to their own specialties to the point where when they sent me to a speech therapist, and I said, well, I don't need to do that because I could just hold my face up like this and then I don't have a speech impediment anymore. Well, the speech guy was more about, you know, me being able to eat, swallow, things like that, you know, petty details like that. But, you know, I did have that doctor fatigue at that point. But, you know, the fact that they introduced, you know, grant that made my pain, you know, manageable without the fear of facing potential addiction, that was huge because that had already been a challenge throughout my treatment. And really when he, you know, brought Dr. Sheila in and she gave me one of those assessment instruments, I'm sure it raised some alarm for her. At least it looked like that from looking at her face. And what really struck me was those two worked very closely together. They collaborated about me behind the scenes, which I thought was amazing, and they worked together to really create a transformative effect for me. I mean, and I think that that's why it's really fair to call palliative care, at least in my case, a game changer. And listening to the panel, I think you're starting to get an indication as to why. I mean, you're approaching a person's healing from so many different angles. So I hope that answered your question, Shireen.
Yeah, I think it is really hard. I think there's lots of different fears that play into, you know, using some of the pain medications. How do you balance all these factors? And I really appreciate you sharing. Natalie, I wanted to know, you know, do you have a response from the clinician side of, you know, what is the ad when you have a palliative care team?
Yeah, I think this is such a good question. And I love, patients ask me, you know, what are you going to do for me? I already see so many doctors. I have so many teams. And I think that's something that we're really mindful of for our patients, because we know that there's so many kind of cooks in the kitchen, and we're really mindful of that. I think one of the biggest things, as Tim alluded to, that we really value and prioritize coordination with all the different teams involved, and making sure that we're all working together and that we have a really coordinated plan to provide kind of the best care for our patients. I know in the hospital, oftentimes kind of we're that piece that's pulling all the different providers together to sit down in a room to talk together to make sure we're all on the same page and have a good plan. And then even kind of coordinating a time to all come and talk to the person and their family together so that they can ask all their questions and kind of just see that we're all coordinating, because I think that's so important. I think one of the other big things that we're able to do is kind of really just take a step back and look at the bigger picture, and really focusing on the person at the center of this. And kind of that's a big thing that I think we provide, is just kind of focusing back in on who is this person that we're all caring for and what's most important to them.
For sure. I think that, you know, all medical teams are trying their very best to help patients and families. And I think in the healthcare system we have now, things have gotten really complicated. And, you know, you might have 5 different teams, and, you know, talking about the different pieces, and it helps to be able to take that step back, as Natalie said, and just remember, okay, all of these things that we're doing, do they meet the goals of the person in front of us, right? If someone wants to, you know, spend as much time at home versus they want to be mountain climbing, you know, the goals are different for every person. You know, you have people who are like, I need to be able to drive my car and walk outside, right? Like, what are the things? And then how do all of our treatments help match those goals? I think is a really important framework that I think sometimes we can help kind of just pull us back to, because we're all thinking about it, but sometimes it can be hard to track. So yeah, I want to move us to the next question, because I think you all, at least Gary, Natalie, and Kafunyi, might have answers for this one. When I tell people what I do, the most common response I get is something like, oh, but oh my goodness, like, isn't that so hard? Don't you just talk about dying? Very well met, right? Like, just people having this idea that like palliative care must be really really hard and really sad to be a field to work in. How do you guys respond to that? Maybe Gary, do you want to start us off?
Yeah, you're right. That is a question that, or a statement that people often say. And my response to that is, you know, hard things are just a normal part of life. I wish they weren't, but not one of us has escaped having hard things happen in our lives. And so that normalizes for me that, yes, there's a sad situation that I'm encountering here, but it is part of life. And I have an opportunity in meeting this situation, in meeting this individual, this family, to try to make things a little better or easier. You know, people are, when they get a serious illness diagnosis, there's a lot of things that they face. Fears, uncertainty, it all feels overwhelming how to manage this. And if we can help relieve some of that, help navigate the way for them, help relieve physical pains, other stressors, then wow, that's a really great thing. And it feels good to be a part of something like that. And the other thing is, it amazes me how much I learn and am inspired by the people that we serve. I see a lot of courage. I see a lot of resilience and faith and wisdom. And wow, that is humbling and inspiring.
Absolutely. Natalie, you want to go next?
Sure. I mean, I think kind of my response to that question is just kind of, I feel so privileged to do the work that I'm able to do. I think, you know, we're invited into some of the most vulnerable moments in people's lives. And I feel so lucky to be able to be a part of people's journey and to help them through some of these really difficult situations. Like Gary mentioned, you know, we get to witness such resilience, even, you know, despite these difficult and sometimes kind of feeling impossible situations. I'm in awe of the people that I meet and the grace and strength that they have, and it really, you know, I leave work just really inspired by the people that I meet.
That really resonates for me too. Kafunyi, you want to share as well? Kind of what's your response? Yeah.
Yeah, thank you, Shireen. Yeah, I echo Gary and Natalie that we really deal with people who are very vulnerable when they go through a serious illness. In my encounters, I worked first as oncology chaplain, working with people who are diagnosed at first with a serious illness, just being in denial, not accepting that this is true. I worked with a lady who had 3 small children, and she was just devastated. And she couldn't accept that this was happening to her because she had these fears, worries of what will happen to the children. She wanted to be involved in their education, in their sports, and she didn't know what to do. She was really devastated. She was in very spiritual distress. And so this inspired me actually when I joined palliative care team. To be able to work with these people and accompany them in their journey as they go and navigate from denial to actually acceptance of the situation, and to be able now on the palliative care to help them to find means and ways to actually cope with their situation. And so I was able to navigate with this lady who had 3 small kids from denial to acceptance of the situation, but especially because she was more worried of tomorrow, what will happen tomorrow. So I was able to help her to go through on thinking of right now, and then be able to get involved in the life of the children in the moment, and to have some quality of life instead of being so focused on the illness, because our care in palliative care is the whole person, and we are not dealing just with your illness, but you as a person on those dimensions, the 4 dimensions of the person, and to help you navigate this. And I was able to go with this person to be able to bring our focus on the quality of life of her and her children, and to find strength of the things that she really enjoyed with those children, that being just concerned of tomorrow. Because tomorrow, basically when you get more worried, then it steals your joy of today. So you better have your joy of today and be able to live by, instead of being so worried of tomorrow. And so that was able to help the person and navigate with that and be able to start more focusing on having that quality time with the children and recording and participating in the activities than being buried off tomorrow. And so that was quite an experience. Like my colleague says, it is really tough to see how they become so resilient, going from when this first was diagnosed, how they couldn't accept it, to the point where they accept, and we're there, accompany them, and along the way and throughout the trajectory. And so it is amazing to see even the outcome, how it's happened on the team.
Yeah, I know, thanks, Kafunyi. I know for me, I got into medicine hoping to help people, and I think all of us do, right, in some ways, and having a very different idea of what it would be like. And I was a primary care doctor and feeling very helpless in terms of how to help some of my patients who are going through crisis moments. I think, something that sticks with me even now is, there's many patients will say to us, I may just be one of your patients. This is a famous quote and also something I hear a lot, right? I may just be one patient, but this is the crisis of my life. And we get a chance, as Natalie said, and I think all of you said, to be in these vulnerable moments. And, they're unfair, they suck. There's not, I can't make it go away, but at least we can help make it a little less bad. And I think moving the needle just a little bit, whether it's making pain a little bit more tolerable, or whether it's, wheeling outside to be able to go sit in the garden, or whatever that thing is. But I think, helping both equip ourselves and equip other teams, and help our patients feel just a little bit better. Sometimes when you're going through something horrible, that in and of itself, it is something to be proud of and to be able to help with. And I think, so it's a different frame, right? Because I know I get that question too. It's, aren't you just, isn't your work so hard? Yes, it is. It's also, as many of you said, a privilege. And I think something that I carry with me is just how lucky I am to be led into these moments. In that same vein of kind of holding, hope and planning, Gary, I wonder, could you talk a little bit about, I feel like there's a real struggle when you're going through something hard, whatever it is, to kind of both hold up that hope and also plan for what could happen, right? And one phrase I hear a lot of palliative people say is hope for the best, plan for the rest. How do you think about holding space for more than one emotion at a time? Like what's a way to do that?
I think one of the things that's important is just to be able to normalize that the true thing can be, I'm scared and I'm hoping for the best. I'm worried, and in this moment, everything is okay. Being able to help people to look at that and see that both can be present at the same time. We often think it has to be either or, but it's often and, both and. And so it's acknowledging whatever the emotion is, and also helping to identify and look for where the hope is. And I think in helping people to talk that through, to listen to people, to validate the feelings, to explore what can, what steps can support and lead them toward what they hope for. That's part of the work. It's part of the walking alongside and journeying with people as they're going through serious illness.
Gary said it really well. I think kind of just being able to normalize that for people, that it's okay to be really hopeful and want to be positive, and also be worried about the future. have some concerns. And I think one of the things that we do is just create a safe space to talk about that and express those feelings. You know, I think one of the things that we do is just kind of meet people where they are, and just kind of allow them to steer the ship, and just starting off with where they're comfortable, and helping them to explore themselves, kind of what's going on. I think, you know, some people that I meet are, you know, I ask them, you know, how do you like to think about information? How do you receive information? What's helpful to you? And they're planners. They want to plan. They want kind of all the details. So that's what we do. And other people, that's not as helpful. So I think that's just something that, again, kind of we're really focusing on what's going to help this person.
Thanks so much. Along those lines, how are ways that friends and family of someone facing a new diagnosis can offer support? I don't know, Gary, if this is kind of in your wheelhouse, but I think if you don't mind chiming in.
Yeah, I think there's a lot of simple things that we can do. You know, first of all, if we want to visit our friend, always ask permission. You know, is this a good time? And being mindful too that when we do visit, you know, energy is different, time is different. So not overstaying our welcome. The other thing is really practice just listening. We don't have to fix things. We don't have to have the answer. Sometimes it's just saying, that sounds really hard. I don't know what to say. So listening, sometimes there's practical things, you know, helping to set up a phone team so that patients can let their network of support know what's going on, but they don't have to talk to each person, using tools like Caring Bridge for that. Sometimes it's helping with daily tasks, you know, meals, getting kids to school, laundry. And there's another tool, Lots of Helping Hands website that helps people organize that and sets up schedules. You know, take your cues from your friend. Sometimes they really want to talk about what's going on. And sometimes all they want is, let's talk about the weather. Tell me about, you know, your last trip to the beach. Take your cues from them. Every illness is different. So really try to avoid making comparisons. You know, we all have the story about our aunt who had, you know, the same kind of cancer, or our uncle who did, and every case is unique, and to make comparisons can be really hard and set people up. So be mindful of that. And I think just rethink the bringing food. People end up with a fridge load of casseroles, and think about, are there other thoughtful gifts that might be helpful? You know, a gift certificate to a diaper service if they have young ones. You know, showing up and mowing the lawn, other gifts. Food is certainly one thing, but be mindful that everybody might want to do that.
Yeah, I've had patients and friends who sometimes will say, you know, I'm running by the grocery store. What can I pick up for you? Right? Like that concrete, is there something on your list I can get? Or, you know, as opposed to asking them what you can do, because I think that sometimes, you know, with the best of intent can feel like not a burden, but, you know, the person who's going through it is also then having to triage what other people are doing. And so but it is really just, I'm here, I don't know what to say, but I can do this, that, you know, and I feel like those are it's so hard to know what to do. And at the same time, just people knowing that you're there and you're thinking of them, even if, and you don't expect a response, I think is the other thing, is sometimes to tell them, just thinking of you, don't feel the need to text me, just those asking permission, as you said. I'm mindful of the fact that time is flying by. So I want to make sure that we kind of answer our last question for each other, and then maybe try to tackle a couple of these that we're getting. So thank you so much for submitting your questions. I know Gary's also going to send out some resources to everyone who's here too. So my last question for the group for now, if people could walk away with just one take-home message about palliative care, we've talked a lot, what would that one thing that you'd want people to walk away be? Natalie, I see you smiling, so I'm going to call on you first.
I think really the main thing for me is just that we're not all doom and gloom. Like we are lovely, nice, happy people that are really just want to make you feel as good as possible while you're dealing with your illness and a really hard situation. And really just getting to know you as a person and how we can help you as a person is just our main goal. That's what I would want people to know.
Thank you. Kafunyi, what do you think?
Okay, yeah. Palliative care is not hospice care. So our role basically is to improve the quality of life for anyone with a serious illness.
Yeah. Absolutely. Gary.
Yeah, for me, it's simply, we're here to help you live as well as possible as you're going through what you're going through.
I don't know that I can say it better than that, but I think, my takeaway would be any given day, it might be something different, right? As you're going through something, one day it might be your symptoms. One day it might be how to pay the bills. One day it might be something else, these kind of waves that we go through when we're facing something hard. And I think what makes a palliative care team a little unique is that we're trying to be attuned to all of that. And we know that it comes in waves. So we do our best to meet you where you're at, as others have shared. Tim, you get the honor of the last take-home point.
Thank you for that honor. Well, I'm sure that Gary and Kafunyi would validate my observation that, the tougher the struggle that you face, the greater amount of spiritual sweat equity you're aggregating. And the challenge becomes when you're so wrapped up in the challenge of scaling the mountain that you get maybe a little compromised on some levels, and you aren't really able to access the rewards that you get as a result of it. And the taller the mountain, the greater the reward that you'll take with you for the rest of your life. And the palliative care process, at least in my case, made it so I was able to access the powerful gifts that I received as a result of that journey, mostly spiritual in nature, but some of them more tangible, more physical as well. So anyway, yeah, I would say that that is my go forth message. When you're facing this struggle, it's not in vain. You are getting an equal amount of benefit as well. You just need to realize it, and this team can help you do that.
Much. We've got very few minutes left, but I was going to try to tackle some of the questions that I see popping up. There's a few. So one is, how do you all practice self-care so that you don't burn out caring for patients? Natalie, you want to try that one?
Sure, that's a great one. Yeah, I think kind of the work that we do is can be really intense. you know, we're really connecting with our patients and the people that we meet. So I think, you know, it's really important to kind of do the things that to fill up your cup, so to speak, at the end of the day, whatever that looks like for you. For me, it's yoga, cuddling with my dog, spending time with family. And I think, you know, at the end of the day, it can be hard, but I think we all also really kind of support each other on our team during the day, and prioritizing taking breaks or just decompressing after a really difficult conversation. And that's kind of a normal part of our work, is supporting one another during the day, which is really helpful.
Gary, other thoughts? Sorry, muted.
Yeah, I think, well, one, I think for me, it's having the, you know, the humility to know that I can't fix everything. And then the perspective to know that I can do my part, and if I can relieve some suffering or stress, even in a small way, that is a good thing. And having that perspective and trying to maintain that helps me.
Yeah, absolutely.
Another question we got was, I may try to anonymize it a little bit. Basically, when someone was going through chemotherapy, there was disagreement between family members on how to proceed, and it was also not what my mother wanted. How do you guys help with situations where families don't agree? And I feel like this comes up quite a lot for us. Natalie, do you want to chime in on that one? I feel like that was yesterday.
Yeah, I encountered this type of situation.
Many situations.
It's really not uncommon. Yeah, I think in our work, especially in bigger families. And I think, I know one of the things that kind of we focus on probably first is just really getting to know the patient and their wishes and priorities first. And then kind of, you know, it's kind of our obligation to honor those, and it's complicated, right? In a family that maybe disagrees. So I think some of our work is just kind of really discussing that and exploring what's going on for these family members. Sometimes it's really, you know, it's out of love, you know, and out of, you know, it might be so painful for them to be watching their family member go through what they're going through. So I think just kind of creating the space, getting together, getting everyone in a room and talking it out, and just kind of seeing what's behind what's going on, and seeing if we can help them kind of come to resolution, advocating for the patient's kind of wishes in the background. And I know, I mean, Gary, I'm sure I think we would very heavily utilize our social work colleagues in a situation like this, and they would be critical. So.
Yeah, and I think it's really important to, like you said, get everyone in the same room. You know, every member in a family has their own particular relationship with the patient. And I think it's helpful to get them to tell me about your mother. Tell me a little bit about who she is. Each person has it. And if she could, and then ask if she could talk to us now, if she could talk to you now, what do you think she might say about where things are for her and what she would want? Yeah. As much as we can bring it back to reflecting on that, I think that helps families.
Yeah, I'll add one more thing, if you don't mind, Shireen, is that is to look at, make sure that if the person has actually an advance directive, because that's where each person is going to be able to list the wishes and what matters and what is important for that person. If there's an advance directive, that will be able to help as well in the conversation and discussion to see actually what is important for that person, what was written in that document. And that might be helpful as well for the family to see what is written in there.
Absolutely. I agree with a lot of what was shared. I feel like concretely, I think, you know, getting to know, having conversations one-on-one with the patient, having conversations with the family, asking the patient, asking the person, do you want my help in talking to your family about this? Because I feel like, as Natalie said, it's complicated, right? Someone might not want something for themselves if they were to decide without input from anyone else. But the truth is, we all make decisions thinking about our loved ones, right? For some people, it's, well, I don't want to do this on my own, but if if it's going to make my, fill in the blank, husband, daughter, whoever it is, feel like they did everything they could, then maybe I'll try, right? And I've seen that happen in my own family, not just for my patients, but also, people make decisions because they're considering the feelings of the people they love. And so we do our best to help them navigate those things, and because everyone's going to want more time with the people that they love. So it's not, as Natalie said, it's from a place of love. As Kafunyi said, it's great to have had conversations before, because then, your family might have a sense of what you want, but these things are dynamic, they change. And so how do we support people in those moments of crisis when maybe one person feels very strongly one way and someone else feels a different way? That's life, that's family, and we certainly can help navigate some of that. Tim, there's a question for you. Are you still getting care with palliative now that things are better?
That's a good question. My last meeting with Dr. Grant, who I just love, and he's just, all you guys, you're just genuinely loving, affectionate people. It's, and you're thinking that they're clinicians. But our last conversation, viewed with love, was like, well, I hope I never see you again. And that is the answer to that question. I don't tap into the palliative care team any longer because I feel like they did their job with me. And so that's that.
Yeah. I also have a lot of patients who don't need to see me anymore, and that's a celebration. That's a good thing. It means we're not in crisis anymore. And I think that's an incredibly positive thing. Thank you so much. We are at 12:55. There are a few questions about how do we find a palliative care team? How do we have an office in the new hospital? We will send out resources on how, because I know not everyone is right in this area, just in terms of finding a palliative care team closer to you. So there's a provider directory on getpalliativecare.org. We also have a website that lists where we're at in terms of our clinic, the hospital. We see patients all over the hospital, and we have a few clinic sites around the Bay Area. Kafunyi brought up the importance of having conversations. Gary, I don't know if you want to spend 20 seconds telling us about the conversation project, but we will send these links out. And so thank you all for being here. I just want to put up a picture of our team and say thank you for all of you joining us today. So we just wanted to say we're so grateful for your time. We hope that this was helpful. Appreciate the comments coming through. I know we couldn't get to all the questions. I'm sorry about that, but hopefully we can have some follow-up. So thank you. And we wish you all the best. Have a great day, everybody. Thanks for joining us today.
Bye.
Bye.